the second virtual event of the 2 Centuries of Jacksonville series in 2022, which is a production of the Jessie Ball DuPont Fund and the Jaxson magazine. Launched by Modern Cities in association with WJCT Public Broadcasting, the Jaxson is a multimedia project dedicated to urbanism and culture on Florida's First Coast. My name is Ennis Davis, and I'm a senior planner with Buettner Company, a public historian, vice president of membership and outreach for the Florida chapter of the American Planning Association, and the Florida Trust for Historic Preservation trustee, as well as a co-founder of online media productions, the JacksonMag.com and ModernCities.com. I will be your moderator for today's panel discussion. Before we dive into the discussion, I'd like to go over a few housekeeping items. Number one, please introduce yourselves in the chat box. You're doing a good job with that, I see. Number two, this conversation will be recorded and shared with everyone early next week. Number three, Lily Weinstein from the DuPont Fund is available for tech support, so please use the chat box to ask for any troubleshooting help. Then number four, we have reserved time for Q&A after our panelists share their expertise. So please use the Q&A function in your Zoom controls to add any questions at any time during the conversation that we'll get to. So celebrating the Community Health Month during the month of April, which also includes National Walking Day, National Public Health Week, and the WHO World Health Day, today's topic will focus on benefits of blue zones. We hope that participants will leave this session with a better understanding of the following learning objectives. Number one, the historical context for why Jacksonville experiences the health disparities we see today. Number two, what is a blue zone and how the power of nine can improve community health. And number three, how we as individuals and with our own personal networks and professional organizations can participate in the Activate Jacksonville Blue Zones project. So today we are honored to have three great panelists join us today. We have Melanie Patz, Debbie Watkins, and Emilia Klabitz. And what I'm going to do at this time is allow for each of the panelists to take a little time to introduce themselves personally and share a little bit about the background. And Melanie, we can start with you.
Hi, thanks, Ennis. I'm Melanie Patz, and I serve as the lead for the Blue Zones Project with Baptist Health, and I lead Baptist Health social responsibility efforts.
Thank you, Melanie. Debbie?
Sure. Hi, I'm Debbie Watkins. I'm an account executive for Blue Zones, and I have been working in Jacksonville now for well over 2 years, have been working very closely with Melanie, supporting what Baptist wanted during the assessment process back to Blue Zones, so being the liaison between Blue Zones and Baptist Health. And I'm delighted to be here and have had such an incredibly positive experience being a part of your community.
Thank you. Emilia?
Thank you. I'm Emilia Klabitz. I lead operations and finance at Blue Zones, and I have had the pleasure of working with Debbie and Melanie over the last 2 years as well. I've been with the organization about 10 years, and I, like Debbie, have experienced such a great and welcoming community as Jacksonville is, and it's wonderful to be here and share a little bit more today. Thank you.
Thank you, Emilia. So now I'm going to share my screen and we will get started. So with nearly 1 million residents, Jacksonville is a city that is blessed with a great natural location, a unique multicultural heritage, in history, and a diverse growing economy. However, today Jacksonville is challenged by trends that threaten the health and prosperity for many residents. For example, according to Gallup, 3 out of 4 Jacksonville citizens are overweight or obese. 2 in 3 report that they are struggling with their hope and purpose. And 1 in 4 report not having enough money to buy food. So I'd like to pose the following question. How did we get to where we are today in terms of disparities in our health outcomes? And I want to walk you through some of the policies that have gotten us to where we're at today. So the built environment we see today is a result of intentional policy, land use, zoning, and infrastructure investments, or lack of infrastructure investments, and decisions that were made at the federal, state, and local level over the last century. In 1896, Plessy V Ferguson was a landmark decision of the United States Supreme Court in which the court ruled that racial segregation laws did not violate the US Constitution if the facilities for each race were equal in quality. Regarded as one of the worst decisions in US Supreme Court history, the decision legitimized racial segregation across the South and in Jacksonville, leading to development of inequitable neighborhood environments based on skin color throughout our city. Plessy V Ferguson also bolstered the inclusion of racially restrictive covenants during the early 20th century in many of Jacksonville's neighborhoods. Racially restrictive covenants, such as the example shown in Murray Hill here that's highlighted, were contractual agreements that prohibited the purchase, lease, or occupation of a piece of property by a particular group of people. The practice using racial covenants became so socially acceptable that in 1937, a leading magazine of with nationwide circulation awarded 10 communities a shield of honor for an umbrella of restrictions against the wrong kind of people. In addition, local land use and zoning regulations also set the stage for the built environment of the city that we recognize today, as well as many of the environmental justice and health disparity challenges various neighborhoods face. Between 1928 and 29, a comprehensive city plan and zoning ordinance was established for the city of Jacksonville. At the time, all African-American neighborhoods were color-coded, either as industrial, which is shown in green, or unrestricted, which is highlighted in dark green, allowing heavy industry to locate within these African-American residential communities. These nuisance industries were also prohibited at the same time in the city's white neighborhoods. In 1934, the Federal Housing Administration furthered the segregation efforts by refusing to insure mortgages in or near African-American neighborhoods. This is a policy that is now known as redlining. Local real estate agents were hired to help appraise local finance decisions based largely upon the racial composition of the neighborhood. The safest or best areas for investment were green, while the riskiest areas were labeled red or hazardous. All African-American neighborhoods such as La Villa, Brooklyn, Moncrief, and Newtown were automatically zoned as red. At the same time, the FHA subsidized builders who are mass producing entire subdivisions for the white community, which that requirement also included that no homes be sold to African Americans. So locally, this led to rapid growth in neighborhoods such as Arlington, Inglewood, and Cedar Hills by the 1950s. The proliferation of public housing in redline neighborhoods also came as a result of the National Housing Act of 1934. In particular, Northwest Jacksonville will be impacted by the first 3 public housing projects built locally. Opening in 1937, the Durkeeville Housing Project was one of the first public housing projects in the Southern United States, and the second behind Liberty Square, which was completed a few months earlier down in South Florida, in Florida. Durkeeville would be joined by Brentwood in 1939 and Blodgett in 1940. Originally middle income, a decline in public housing living standards took place, leading to all 3 public housing complexes being characterized as crime-riddled by the 1980s. Then came the urban highway system. Here are a few images of Sugar Hill, which was Jacksonville's most prestigious early 20th century African-American community. Located just west of Springfield, this neighborhood included a 5-point style commercial district at the intersection of West 8th Street, Davis Street, and Monroe and Moncrief. That was a thriving destination for Black-owned businesses and wealth. The Jacksonville Expressway, which became Interstate 95, opened for traffic on March 26, 1960. Originally proposed in 1945, the expressway's route was locally determined by avoiding areas deemed most valuable to segregation era leaders at that time. This meant that red line neighborhoods, including Sugar Hill, became an instant target for expressway construction and blight clearance via eminent domain. By 1970, additional neighborhoods, including La Villa, the East Side, Moncrief, Mixontown, Brooklyn, Durkeeville, and Lackawanna, were negatively impacted by the construction of Interstate 95, Interstate 10, the Martin Luther King Parkway, and the Arlington Expressway. Homes that had been a short walk to shops, public parks, community centers, and libraries now overlooked wide highways, and those communities were also more vulnerable to extreme heat and exposure to air pollution when compared to neighborhoods and residents where these projects were not intentionally imposed upon. In addition, business districts that relied on regional automobile traffic, such as Springfield's Main Street, Mixontown's Edison Avenue, the Point and Moncrief, and La Villa's Broad Street, all declined as a result of traffic being diverted to new limited access highways. So with the completion of the urban expressway system, these highways became a new racial demarcation line between the red line neighborhoods that surrounded downtown. And since that time, generally all historic communities of color on the downtown side of that expressway system have been targeted for repeated urban renewal programs. Overall, as a result, these intentional policy and infrastructure decisions have resulted in a pre-consolidated 30 square mile city that was walkable and very transit oriented, losing nearly 50% of its population and density since 1950, elevating the challenges with many disparities that we see residents facing today. Blue Zone seeks to improve the health and well-being of the entire community by impacting the places and spaces that people live, work, and play. Sponsored by several organizations and entities, Blue Zones has the potential to assist in the repair and rehabilitation of the existing human-made built environment that is a result of a century of unequitable public projects, policies, and infrastructure investments. So with this in mind, I have a question from Melanie regarding Blue Zones. I'm just going to leave the screen up until you can answer this, Melanie, and I'll turn it over to you. But this question for you, Melanie, is how did Blue Zones come to Jacksonville and who is leading the charge for this project?
Ennis, thank you so much. That introduction that you just gave really sets out the history of how we have disparate outcomes, health outcomes in our various neighborhoods in Jacksonville. So Baptist former CEO worked for a health system in Fort Worth before coming to Jacksonville. And he saw firsthand the health and well-being improvements that Blue Zones created in that community, including statistically significant decreases in obesity, as well as smoking rates, and increases in life satisfaction. And that was across the city, the entire city, not just particular areas. So those segregated areas in Fort Worth, Texas, with lower income and higher diversity, higher people of color, experienced improvements as well. We spoke with several communities that have participated in a Blue Zones assessment, and all of them indicated that Blue Zones is the only model proven to improve well-being at a population level. After a couple of COVID delays, you heard Debbie and Emilia mention that we had some, it's been a 2-year process that we've been working together. The Blue Zones team completed its completed its assessment in May of last year. And the assessment indicated that Jacksonville is ready for improvement in health and well-being, and we can use our assets combined with the expertise of Blue Zones to dramatically improve our life satisfaction and our well-being throughout the community. And as I spoke with Jacksons during the assessment and following, I became convinced that the Blue Zones model offers a comprehensive, proven way to unleash the individual and collective potential of Jacksonville's most important asset, our people. I am delighted that leading the charge to implement Blue Zones is a coalition of committed community organizations. And as you had all of their logos on the screen earlier, thank you for that. And we're delighted to have representatives from each of us with us today. So joining Baptist are the City of Jacksonville, and Dawn Lockhart, who is the Director of Strategic Partnerships, is with us today. UF Health Jacksonville, represented by Dr. Ross Jones, who is the Medical Director of Community Health, the Total Care Clinic, and the Urban Health Alliance. Mayo Clinic Florida, represented by Ashley Pratt, who serves as the Director of Community Engagement. Florida Blue, and with us today is Christy Aiello, who's the Regional Director of Business Development. United Way of Northeast Florida. Joining us is Marie Murcho, Chief Development Officer, and the Jacksonville Jaguars. And with us is Whitney Meyer, Senior Vice President and Chief Community Impact Officer. Thank you, Ennis, for that great question.
Thank you, Melanie, and thank you for the introduction for the rest of the sponsors and their representatives that are joining us on this call today. So Debbie, I want to turn to you now, and I have a question for you. Can you tell us more about what Blue Zones are and the principles involved?
I certainly can, and if you don't mind, I'm going to share my screen. All right, so I would like to spend a little bit of time talking to you about Blue Zones, about the benefits of Blue Zones, how they were started, and then how they can benefit Jacksonville. So I do have to say, in addition, I do want to share one story before I get started. Speaking of our experience in Jacksonville already, I have to say it started with my Uber driver. So the first time I came to Jacksonville, I had an Uber driver who could do nothing, for 20 minutes, other than talk about how great Jacksonville is. So there's an incredible shared passion in your community, which is absolutely a perfect place for Blue Zones to do our work. So moving forward, I have a question to pose to all of you. Would you rather have more life in your years, or more years in your life, or more life in your years? I've posed this question before in presentations, and it is one that gives you just a moment to pause and think. So you think about it and you think, well, sure, I want to live a long life. But do you want to live a long life where maybe you're a burden to your family, or you're living with chronic illness or other infirmity? And then that changes your perspective a bit. So what if you could have both? And that's what we want to talk about today, because at Blue Zones, that's what we're about. It's our calling. So we want everyone to have more years in their life and more life in their years. And we do that by empowering everyone everywhere to live longer, better. When we empower you, we want to co-create the opportunities, the process, and the environment with you. So you heard Melanie say that we working alongside our experts. So we want to work with the community to make sure that we transform your environment. We are community-led and community-driven. We provide the expert guidance, advice, and recommendations, and support you in your efforts. By everyone, we mean everyone, everywhere, all individuals, all organizations throughout the community. And we want your life, everyone's life, to be healthy, long-lasting, and happy. So Dan Buettner is our founder. He is a National Geographic explorer and best-selling author. His groundbreaking research has helped people across the globe lead healthier, happier lives. And it started by identifying the places across the globe where people live the longest, the healthiest. Those are in Okinawa, Japan, Icaria, Greece, Sardinia, Italy, the Nicoyan Peninsula of Costa Rica, and Loma Linda, California. In these areas, people reach 10 times greater than in the US, and they report being at the top quintile of well-being. So after identifying these 5 areas, Dan took teams of scientists back to each location to identify the characteristics that might explain longevity. He found 9 common characteristics among these 5 areas, and they are the pillars of Blue Zone's work. These are the Power 9. They are to move, to have the right outlook, to eat wisely, and to connect. And there are different aspects of all of those as you move throughout that I'll go into a little more detail about. So here you see a man building a stone fence, a young man, I would like to say, but he is still very active as he moves into his senior years. And that's one of the principles, to move naturally. People in the Blue Zone areas worked in their garden. They walked to visit friends. They walked to a neighborhood store or to get their food for dinner, or they got their food from their own gardens. Whatever they did, they moved about. And that's what's so important, to maintain movement throughout the day. They had the right outlook. They knew their purpose. Research shows that a sense of purpose is worth up to 7 years of life expectancy. And the people in these areas woke up every day knowing their purpose and pursuing that purpose throughout the day. In addition to that, they took time to downshift, to de-stress. In Okinawa, they took time to remember their ancestors. In Icaria, they took naps. In Sardinia, they had a glass of wine after work with friends. And in Loma Linda, they took time to pray. All ways to take a breath and sit back and take the stress out of your life. You know, stress leads to inflammation, and inflammation leads to numerous health issues. So it's really important to take that time. They had the right outlook. I'm saying it again because I just want to share this picture of this lovely woman in the Nicoyan Peninsula of Costa Rica who dresses up every single day, all her jewelry, her bracelets, her party clothes, and walks out onto her porch to greet everybody who passes by with a joyful smile and a joyful disposition. They ate, or they continue to eat wisely. In Okinawa, they have a phrase that they use called Hari Hachi Bu, which means get up from the table when you're 80% full. Stop eating when you're 80% full. If overweight Americans abided by Hari Hachi Bu, they could lose an average of 17 pounds in the first year. I think that we are, in our Western culture, we have become so used to supersize it and have big buffets and have huge servings on our plates, and it's not necessary. And we often go to 100% full, and there's no need to go that far. They also have a diet that's based primarily on plants, often grown in their own gardens. So they're not vegans necessarily, or even vegetarians, because they do eat meat from time to time, but their focus is on eating good food from the good earth. They are also, they tend to have a glass of wine every day. They're moderate. It's in moderation, 1 to 2 per day. Then the other thing that you see here, which I love in this picture, is that food was a celebration with family and friends. It's not running through a drive-through and getting food and then gobbling it down in 5 minutes. It is taking time to truly celebrate and spend time while you're enjoying your dinner. They were connected. If you have a life partner, it can add 3 years of life expectancy. They also had the right tribe. They would have in Okinawa, as an example, they have something they call a moai, and that is 5 friends that they keep for life. And these friends stay connected, they support one another, and you need that support to maintain healthy behaviors. If your friend group is healthy, you'll be healthy too. They belong. They put family first. They invest in their children with time and love, and children care for their elders. They also often are parts of faith-based organizations. And research has shown that attending faith-based services 4 times a month adds 4 to 14 years of life expectancy, and the denomination doesn't matter. It's just all about having those connections and feeling a part of a community. So with that, I'm going to turn it over to Emilia, who will talk to you about how we take these 9 principles, the Power 9, and use those in our work in communities. Emilia?
Thank you. All right.
I got to stop sharing. Sorry. Let me stop sharing. That would help. My bad. Here we go.
Okay, great. I'm going to share a little bit more about how we take that Power 9 and apply it to our own lives in the United States and across the country through our Blue Zone Project initiative. All right. I'm going to also share a few slides. Some presentation mode here. Great. So I'm going to talk a little bit about how we take that Power 9 and really put it to work in communities. And we do this collectively. It's not really something Blue Zones does to a community. You've heard Debbie talk about that a little bit, but it's really work that we do together in collaboration. Blue Zones has a framework and a model and an approach that has proven results to improve health outcomes and well-being overall for everyone in a population. So that Power 9, really taking a look at that and thinking, how do we reverse engineer that in the United States? And our approach is what we call the life radius. As Americans, we spend the majority of our time within 20 miles of our home. That's where we work, where we play, where we pray, where we do our grocery shopping. And as part of that life radius, we consider our work in 3 distinct areas. We work with individuals, we work with organizations, and we work at the policy level. So people, places, and policy. And in those areas, we have a model and approach. And I'm going to talk a little bit about what we do to really change the environment and the systems to make healthy choices easier for everyone. So it's really an additive model and approach, and not something that's meant to take things away or be punitive in nature, but really to change the environment so that there are healthy options. All right, I'm going to start talking about how we engage people. And you heard a little bit about in the Power 9 how individuals engage with each other. Really through that sense of connectedness and community. It could be how they experience their environment. And through our process, we create that opportunity for individuals through engagement. We work with individuals to help them understand what they can do in their own homes and their own lives to create a healthier environment where they have healthy choices. We provide a checklist and a pledge for every person to take who wants to engage with the community project. And our goal is really 15% of the population 15 and over. To reach a critical mass, so what we would call a tipping point. It's really that tipping point theory. If you reach enough people, they're going to start to filter out through their connections and their networks and really change the culture, the conversation, the understanding of what is your own health and well-being, and how do you play a role in that, and what what can change, or what can you change in that process. And to facilitate that, we create Blue Zones Moais. We have social groups that do all sorts of activities together, like walking, like creating plant-based meals together. It could be engaging in a variety of activities, but it's a committed social group that takes place over a 10 to 12 week time frame, where people are paired together to meet new people and engage in healthy behaviors. We foster opportunities to connect through purpose workshops, and then connect them to volunteer programs. So helping people find their purpose and then take that purpose into action through volunteerism in their community. Like I said, we work with others to engage people on a broad level. There's a distinct approach to sharing the information across the community through partners and civic organizations, faith-based organizations, and engaging in the media. Throughout the course of our project, we'll have a media partner or many to share the information about what's taking place and what the opportunity is in the community project. Next, I'm going to talk a little bit about the places in which we work as well. So just like our work with individuals, we have an opportunity and approach to work with restaurants, grocery stores, faith-based organizations, workplaces, schools, any place where you're going to spend the majority of your time outside of your home. Blue Zones is engaged and looking to create healthier options. With restaurants, we look to engage about 10% of restaurants in our life radius area, increasing those healthy options through plant-based offerings, education, and improving the work environment. We also work with grocery stores and corner stores, looking to engage the places where people access their fresh fruits and vegetables. We look to increase access to fresh fruits and vegetables, not only through the design of the store, but also to improve opportunities for that in environments where we've had a lot of success in working with corner stores to create healthy and fresh food options that create more of accessibility in areas of less access to food options such as that. And in particular, we work with schools, a great way to improve not only the lives of children and improve really critical health outcomes like obesity and education around one's health and movement, but this also translates into how individuals or students engage with their families. I have a 5-year-old daughter, and what she learns at school, she takes home. That includes all the good behaviors and sometimes some unhealthy behaviors. So creating an environment where children can understand and learn about healthy behaviors, about how their environment impacts that, and participate in that through community and school gardens, changing some of the approach to snacking during the school day, and making things like sugar sweetened beverages less accessible throughout the day, and then pairing them with healthier options. We also work with work sites, as you see here, looking to engage a critical mass of individuals in their workplace to create that healthier environment, and work with organizations to address their policies so that well-being and health are at the forefront. Healthier employees and those with higher well-being will cost less and perform better. So there's always a good incentive for not only the worker, but also the employer as well in this case. And then finally, and one that I think is kind of the cornerstone of the work that we do in communities, is to really change the environment through policy change and implementation of programs. We work in the built environment, food systems, tobacco, and alcohol to improve environments so people have accessibility to bike and walk safely. There are more options to be in shaded places when it's hot and improve the environment so that the heat index can come down in neighborhoods. Create greater access to fresh fruits and vegetables, and then also educate individuals on not only how to grow them, but use them in their own lives. And then to create greater accessibility through things like mobile markets and corner store redesigns, as I talked about. We also work in tobacco to reduce the prevalence and improve signage and understanding of not only smoking, but vaping, and reduce that accessibility and marketing. And similar to that in alcohol policy, we're looking to reduce the excessive alcohol use and misuse of that. So I talked a little bit about what we do and how we do it from a timeline perspective in our work in Jacksonville. Our first 9 months of our project will result in a blueprint for transformation. That's where we take a strong look at what's taking place today and what are the great things and opportunities already happening, and how can we provide lift and leverage to those to advance the overall health and well-being. We hire a team, we work with our experts, and we also oversample in the community or take a well-being survey across the community. This is our North Star metric and one of the many measures we use, but is also a critical element to success over the period of the project. Like you saw in our three core categories here of work, policy, places, and people, there are these distinct pillars. So our blueprint will address and provide strategies and opportunities to collaboratively work to improve the community in all of these areas. And it's not Blue Zones coming in and saying, here's what we need to do and here's how we do it. It's really Blue Zones and a team of people from Jacksonville hired on the ground, and a coalition of community leaders, volunteers, coming together to say, how do we want to change Jacksonville to improve health and well-being for all? And what are the best opportunities to move forward? Blue Zones brings menus and checklists that provide the best practices in all of these areas, and really focuses on that collective decision-making to move that forward. We're going to do that over a 5-year time frame, and that's going to really drive awareness and engagement across the citizens and organizations of the community to improve well-being. We're going to improve key components that the community selects for improvement, such as childhood obesity. There are many other metrics communities we've worked with are looking to improve in addition to overall well-being. Those will be outlined in the blueprint in that process. And we're looking to reduce health risks that lead to that improved well-being, and deploy our work across the 3 sectors and improve self-reported metrics as well. So that's what we've done in other communities, and it's unique and individual in each place, but we've seen some really amazing results. From small communities like in Albert Lea, Minnesota, all the way through large communities like Fort Worth, Texas. You heard Melanie talk earlier about the experience that the past CEO had in Fort Worth, Texas, and they saw some really material changes across their community. That lifetime reduced smoking value of $20 billion and a really dramatic drop in smoking. We've seen gains and increases in self-reported metrics around improved fruit and vegetable consumption. We've seen really dramatic drops in childhood obesity and obesity overall in adults as well. And in Albert Lea, we saw $40 million in follow-on grants to improve the environment, to create a more bikeable, walkable center in their city center, which really dramatically improved and impacted the economics of their community as well. And then finally, we work with organizations as well. NCH Healthcare System is a large employer we work with and sponsor of the Blue Zone project in Naples, Florida, and Collier County. And they saw a very dramatic result by implementing Blue Zone's certified worksite program. Overall, a 7% well-being improvement. So that's really that self-reported life evaluation. In addition to that, and what I think is a phenomenal result, is that 27 million reduction in self-insured medical claims as well. So overall, all of the communities and organizations that you see here experienced a greater than 5% sustained well-being improvement over the course of the project and continuing on today. So I'm going to end there and I think pass it back. I'll stop sharing. I'm going to pass it back over to Debbie and possibly Ennis as well. Is that correct?
I'll thank you. So what I'll do now, I'm going to throw this back to Debbie, because that was great learning more about the Blue Zones initiative and the Power Nine, and seeing actual examples built, examples that have come to fruition for the community. So Debbie, this question's for you now. So let's bring this back to Jacksonville. What have we seen so far, and what can our participants here today do to be a part of this project?
So thank you, Ennis. I am going to share my screen once more. I will go through these quickly. Here we go. So let's talk a little bit about Blue Zones in Jacksonville. Emilia gave you an understanding of the kind of work that we do in communities and the kind of work we will be doing in Jacksonville. So I just want to give you a little bit of framing around what has been done thus far in Jacksonville and where we're headed. So I'm going to start with a timeline. Melanie really walked through most of this in the context of what occurred in the beginning with our initial assessment and then our readout and proposal. What we've been doing since we finished that work around actually June, when we did a value presentation, has been looking for sponsors. And Melanie also gave you the list of sponsors who have stepped up. We are absolutely so pleased to have the sponsors that have stepped up to fund this project. It's been really exciting to be a part of that, because they have a shared passion for the community and a shared passion for elevating the health and well-being of all the residents. So when we began the project, we did, this is review for a number of you, because a number of you were at our kickoff event and have been aware of what we're doing. So I'll move through this quickly. We had our kickoff event in January. Dan Buettner was our keynote speaker. During our assessment process, we had 39 Blue Zones experts in the community, and these are experts from across the nation and actually across the pond. We had over 140 organizations that were engaged. And during this whole process, we have interviewed, it says 275, but when you add in the time we've spent with trying to get sponsors in the community, we're well past 300 people that we've interviewed during our time in Jacksonville. So we feel like we have a really comprehensive understanding of the needs. Our collaborative of leading experts, we're very proud of this. We have experts from well-known organizations. These are really bright people who also, like the sponsors in Jacksonville, share a passion for elevating the health and well-being of all people. I just want to give you a snapshot of some of what we found in our initial assessment. Now I want to put the caveat on this, that this is not necessarily, this does not represent what we will pursue. It does show that there is opportunity in Jacksonville, that we found initiatives that we could put in place that would help and support your efforts to drive and improve health and well-being. We will come back and our experts will do a deep dive around what the needs are, and those needs will then be further vetted by our governance committee, which is made up of our sponsor organizations and other community leaders. But you see that it reflects some of what Ennis was talking about in the beginning with the need for improvements in the built environment. It reflects what Emilia was talking about with alcohol, tobacco, and food. So all of these, in addition to the work that we'll do in people and places, there will be what Emilia shared with you, a blueprint that is specific to Jacksonville around all of these areas. I just want to point this out because I think it's important. You did hear Ennis share some of the Gallup survey metrics that were gathered during our assessment process. One of the key indicators is life satisfaction. So this is a question that's in the Gallup survey that says, how would you evaluate your satisfaction with your life looking at steps on a ladder from 1 to 10, 1 being the lowest, 10 being the highest. So as you can see in Jacksonville, the highest level of life satisfaction is about at the 7.3 range. You think about that as the 7th step on the ladder, with the lowest level being almost a whole step below that at about 6.5. So when we looked at the opportunity, we really did look at that variance between high degrees of satisfaction with your life and much lower degrees of satisfaction with your life. And through that, we identified 2 focused zip code areas in the north side, 322, 06, 08, and 09, and in the west side, 32210 and 32244. At this point, we are prepared and ready to start on the north side, and we are at the point of consideration for when we start on the west side. We may start both at the same time. We're still in discussion about that. But the other component of what we will bring to Jacksonville is a countywide umbrella. So because you have a consolidated government, we'll be doing countywide policy, and we'll have an approach to your one school system. So we'll be working very directly with your school system to implement programs and policies there to, as Emilia talked about, improve the health of your children, which will then also impact the health of adults in the community. We plan to start with somewhere between around 14 FTEs. So these are people that we will hire from the community. We're not going to bring them in. We're trying to hire completely local, and we will hire specific to the neighborhoods where we're going to be working. We also expect to have office staff that sit in the neighborhoods where we'll be working. Emilia already explained that we have a foundation period and then a transformation period. So through all of this, what Blue Zones wants to do is be aligned with the community in driving value. We want to drive purpose for everyone and deepen the engagement of all citizens. We want as many people as possible engaged in this project. Through this, we hope to improve health, well-being, and resiliency. And then by doing that, also lower health-related costs. In addition, improving that health, well-being, and resiliency will improve individual and organizational performance, and it will vitalize the regional economy, all to give Jacksonville the kind of name that you already have, but to take it a step further and improve that. So with that, I will end with just a call to action for everyone here. What we would appreciate is if this presentation inspired you, interests you, and made you have the desire to take part in this, we would love for you to share your name and email address in the chat. We will get that information back from the DuPont Fund. And then we will, once we launch in June, we will be getting back in touch with you to make sure that you become a part of the work that we proceed with in Jacksonville. So thank you very much. I will stop sharing my screen.
All right, thank you, Debbie. That was an excellent presentation, very excited. So what I want to do now, we're going to jump into the Q&A session. So if you have any questions that you would like the panelists to answer, please use the Q&A box to drop those questions in. I'm also going to ask a few questions from some of the additional sponsors that are on this call today. And I'm going to start that off while everyone else puts their questions to the Q&A box. So I'm going to start off with Don Lockhart from the city of Jacksonville. And Don, here's my question for you. So it's great to see the city of Jacksonville is listed as a sponsor for Blue Zones. As we all know, we are about to experience a change in leadership at the mayoral and city council levels. So what will be the key way to keep the city engaged in this work?
Well, thank you, Ennis. And will start by saying I really appreciated Debbie acknowledging the passion of Jacksonville. I think one of the very special things about Jacksonville is that we are very, very collaborative. And in fact, some of you may not know that Mayor Curry was the first mayor in the southeast region of the country to create the role that I sit in, which is the Office of Strategic Partnerships. And the reason I bring that up is because Blue Zones is about the alignment of the public sector, the private sector, and philanthropy around ensuring the health of our community. And so it's key that government is at the table and that we're doing our part to ensure that we're building those bridges and creating those crosswalks between the different sectors that we're working with. And I've been doing a lot of that in the space, and I've had the pleasure of talking with a lot of Blue Zones staff about the work that we've been doing. So a couple of examples that I can share with you that I think will be really important is number one, and I know Blue Zones already has this, but to make sure that there is a very strong and detailed dashboard that is made available and shared on a very regular basis to all the elected officials. They're very busy people. They meet with people sometimes every 15 minutes of a day. And so know that you may have presented information to them on a regular basis and continue to do so, because it's really important that they get the ability to understand and to be able to speak about the dashboard and the components of that. The second thing is, by virtue of the fact that we have so many different elected officials in our community, and I know we're starting on the west side and the north side, but find a way for every elected official and the office of every elected official to become a champion in the district that they represent to carry the Blue Zone principles forward. It could be something as simple as engage them in reaching out to the businesses that are in their district and ask them to be enrolled in this process. So give them some ownership about how they can actively engage in this process, and then report back to them on the success. And then on the opposite is to make sure to engage the CPACs, the Citizens Planning Advisory Councils. That is a structure that is set up, an infrastructure within the city of Jacksonville that is made up of citizens that are in the communities that are going to be served, and let them be champions for this work. And when you have those kinds of advocates, and then you build intentional crosswalks between those two, then we're going to have a much better success in making sure that the practices and principles of this work carry forward. And I think that's really much of the process that I've used in working to align organizations that are in the space of homelessness and organizations that are in the space of affordable housing, and really connecting the dots between them. And that process has worked, because Jacksonville is soon going to be able to announce that we've ended veterans homelessness. Homelessness continues to decline, but it happens only because of the alignment. So we're very excited. The mayor is very proud to be a part of this, and we look forward to great results. Thank you.
Thank you, Don. So now I want to reach out to Dr. Ross with UF Health. I have a question for you, Dr. Ross Jones. So Dr. Jones, as a physician working in zip code 32206, your insights are critical. What are some of the assets and challenges that your patients experience in maintaining their health?
Some of the assets, and what I love about the Blue Zones model is they actually acknowledge this, and sometimes I think we forget, is that sense of connection. Our patients are very connected to these historically underserved neighborhoods, and they're also connected to that robust faith network we have here in Jacksonville. So I'm really excited about that. That's some of the challenges we have, which many of us on this call already know, is around the built environment. For us at UF Health, we're particularly interested in the food insecurity and the food deserts that we've noticed here. We've tried to do some of that work with the Urban Health Alliance, which will align with the Blue Zones work that we've agreed to partner with. But we still need to address how can we make sure that all of our residents have access to healthy foods and that's affordable. In addition, we also have a lot of transportation barriers. This limits patients' access to our clinics and hospital systems, and how as we community make our communities more walkable and safe for all residents.
All right, I appreciate that. So what I'm going to do now, I'm going to mix sponsor questions in with some of the questions that are coming in from the Q&A box. So I'm going to take a Q&A question here, and this is going to be to any of our panelists to answer. So can you talk a little bit about how you approach mental health wellness separate from physical health and well-being? And that's for anybody to answer.
I might just jump in right away on that. From a Blue Zone project perspective, and the work that we do in communities is really to address that through supporting systems approaches to addressing mental health, and then also through our individual engagement programs as well. So, we all know that health and mental health and physical health are all interconnected with each other as well. So creating a place, accessibility, affordability, and environment that supports overall well-being, plus helping people connect to their purpose, find programs and access and resources within the community, and try and improve that access as part of our program. Debbie, would you add anything?
Yeah, I just want to say specifically when we're talking about school-age children, I think that there are incredible opportunities, or we have actually experienced opportunities within the schools to get kids connected. So getting kids connected around volunteer projects, other ways that they take them out of isolation, which a lot of kids who struggle with mental health issues are also very isolated. So bring them out of isolation, get them involved in some of the Blue Zone projects that we will pursue in the schools, like putting in school gardens, other things that get them, or developing MOIs where they can walk together and do other activities together. The activities that will help them improve their well-being and their mental health by being involved and engaged.
Ennis, I would like to answer that as well. So as you all know, the pandemic has resulted in increased mental health challenges. And the Blue Zones team did some research after the first year of the pandemic, where they looked at surveys completed by people who live in Blue Zones communities and people who do not live in Blue Zones communities. And those surveys asked them questions like, did your income change during the pandemic? And did you feel anxious during the pandemic? What they found was that the communities, the people who responded who lived in Blue Zones communities had less anxiety than people who responded to the survey who did not live in Blue Zones communities, even though the people in Blue Zones communities indicated that they had more loss of income than people in other communities. So I think that just demonstrates how when we are connected with each other, when we have relationships with one another, that promotes our mental well-being in addition to our physical well-being.
Thank you. Okay, I'm going to go back to our sponsors, and I'm going to ask a question for Ashley Pratt with Mayo Clinic. So Ashley, Jacksonville has high quality healthcare services, including Mayo Clinic, Florida. Why are our health systems sponsoring Blue Zones in Jacksonville, and what do you hope to accomplish?
Sure. Thank you, Ennis. Very excited to be here, and Mayo Clinic is really thrilled to just be able to support this initiative, this really collaborative effort for our community. So I'll just share a few things of the why and the hope, right? So our Northeast Florida Collaborative CHNA that's done among all the nonprofit hospital systems, year after year after year, continue to see the same needs over and over again, such as we're talking about it right here: mental health, health disparities, poverty, food insecurity, chronic diseases, access, transportation, housing, cancer. I mean, the list goes on, but they continue to show up every year. And so I'll just share an example from the CHNA kind of data collection, and where our community expresses the need that really shows the alignment and the desire of the Blue Zones and the goals from the community. So during a lot of our data collection period, we received feedback from the community through interviews, identifying health disparities, disproportionate burdens that we're talking here today for our under-resourced and underrepresented populations, as well as the social determinants of health being a barrier. And we all know social determinants of health, right? Health contributes to really 20% of it. 30% are healthy behaviors, like we're talking about smoking and diet, 10% environment, and 40% social economic. A solution that was proposed through that was recommended by the community in various venues that collectively, as the community and organizations, need to invest together to address the neighborhoods and zip codes that have the greatest barriers to health. So the resources, healthier options, increasing access to public transportation, improving the access, healthier, affordable food options, housing, improvement, access to parks, and create that really sense of community wellness. We're hearing the information here about blue zones, how it really tackles each of those areas that we're hearing from our community to come together. But it's really important for us, in order to achieve the change, right? Community organizations, we need to work together to create this. But it's important to notice that we do have differences among populations in the areas, as well as the priorities from stakeholders and the collaboration to the community members. So in summary, really, to sum it up of kind of pulling the answer back to the question, is a different approach is clearly needed to address the issues that plague the Northeast Florida Collaborative CHNA every year in the community, and the proactive coordination and investment from our healthcare systems and community organizations area will really allow us to optimize the efforts and really pool the resources to achieve the goal for health in our community. So Blue Zones Jacksonville will definitely help take that collective action approach and really maximize our efforts to show the most impact to all individuals involved.
Thank you, Ashley. I appreciate that. I'm going to jump back to the Q&A box and take another question here from our participants here today. So this is for anyone, again, on the panel who would like to answer this question or take a stab at it. This question is, City of Jacksonville is currently doing a resiliency study to develop a citywide plan. This includes things like heat islands and flooding. Could the Blue Zone plan have synergies with the resiliency plan? For example, your policy slides show trees to provide shade. So that's the question for anyone to take a stab at.
I'll jump in and say that's a resounding yes. And we work very closely and will work very closely with the city in support of that plan and how we can best execute healthier, safer, more walkable, bikeable environments for everyone. So, and look to implement projects in the next 5 years to see those come to fruition for people.
And just to add to that, we are moving forward. And for those of you who have not met Ann Colanese, our Chief Resiliency Officer, she is everywhere in the community. She has just presented a lot of work before the task force she's been working forward. And so the timing of the implementation of Blue Zones, as well as the alignment of her work, Ann and I work together all the time. So you can be assured that there will be definite crosswalks between all of that.
And I just want to add that the Blue Zones team, you heard Emilia when she talked about some of the results from other communities, talk about follow-on grants. And that's not a phrase that's necessarily in our vernacular in Jacksonville, but what that means is the Blue Zones team identifies resources outside of Jacksonville and brings them in to implement the plans that are identified, which includes some of those infrastructure needs.
Thank you. All right, so now I'm going to jump back to our sponsors. And this question is for Christy Elio with Florida Blue. So Christy, as an insurance company, what excites Florida Blue about the Blue Zones coming to Jacksonville? And what do you expect to change as a result of this project?
Okay. Hey, everybody. Thanks for the question. Well, first, I just would like to thank Baptist, especially Michael Mayo, Melanie, Patz, for their leadership on this community health initiative, as well as all the other community partners who are invested in the work. You know, the fact that we have so many community leaders committed to improving the state of community health in Duval County it's really amazing. And I love the energy behind it. We're very proud to partner with these community partners in helping to improve the health of the community. This coalition of partners studying this issue and working to identify and implement these needed solutions is going to be a benefit for everybody in the community, especially those neighborhoods where the circumstances don't afford them the same health outcomes, as we saw, Ennis, in your presentation outlined so clearly and poignantly, really. We expect that the work with the Blue Zones will highlight the various health disparities and inequities that contribute to some of the less than stellar health outcomes in Duval County. Duval County in the county health rankings is ranked in the lower middle range of counties. And we especially struggle with obesity and inactivity, as we saw in one of the other presentations. And so this Blue Zone work is going to be very, very welcome. I was reading through some of the Blue Zone outcomes, and they talked about especially lowering ER visits, lowering hospital visits, and taking some of that cost out of the system, and just overall getting people to a healthier place. A final example is that life expectancy in Ortega is 13 years longer than in Durkeeville, and those two neighborhoods are separated by just 8 miles. So I think the Blue Zones work also, as we heard, will help in not only lengthen life, but improve those years that'll be remaining also. And we're just super proud to be a part of the work that helps to address these health disparities and inequities.
That's actually pretty shocking to hear that those neighborhoods be that close and the life expectancy to be that far apart. Okay, now I'm going to reach out to Maureen Murcho with United Way. I have a question for you. Maureen, your question is, United Way partners with many strong organizations working in the neighborhoods that have been identified for Blue Zone focus. What makes you excited about the Blue Zones partnership?
Well, thanks, Ennis. And I want to thank the team that's on this call as well, and Melanie and Michael Mayo for stewarding, and the Blue Zones team for stewarding this project to fruition, to get it where it is through the pandemic and everything else that was going on in the community. I think it's phenomenal that we have this opportunity in Jacksonville because it is about partnerships. So first of all, our mission at United Way of Northeast Florida is to solve our community's toughest challenges by connecting people, resources, and ideas. We know that the problems we tackle can't be solved in a vacuum. It takes tremendous commitment and diversity of partnership across our community to drive these results, without which they won't happen. And we see Blue Zones as that opportunity of connection, which is a word we've heard throughout everybody's presentation on the importance of how we work together, both individually and as a community. We also know that basic health and well-being and equity in wellness are fundamental building blocks to creating economically stable and mobile communities, something that you're going to hear a lot more from United Way in how we do that in our community, where right now, if you're born into the lowest rungs of poverty, you have less than a 5% chance of climbing to the higher rungs. That is not an economically mobile community. And as Ennis shared with us, the historical connections of policy and built environment have a lot to do with that. So in the true sense of bringing people and resources and ideas together, we see the Blue Zones partnership to be a collective partnership, bringing the Blue Zones expertise together with all of the partners you see here on the call and others in the community, spanning many organizations and driven by data and real world evidence. It's also, most importantly, going to be informed by those closest to the issues, something that in the past we haven't always done. Our vision is that partnering with Blue Zones will serve to amplify our own work and the outcomes we're striving for, a truly healthy and economically mobile community. We also love that the Blue Zones theory of change includes at its heart, first focusing on the built environment and the policies that create it as a driver of creating individual behavioral change and health, not the other way around, which we so often hear. We believe this approach has the possibility for real impact, as evidenced in other Blue Zones projects that we've heard about today. And we are thrilled to be a part of the team driving those kind of outcomes. So thank you for the opportunity for our whole community.
Thank you, Maureen. Now I'm going to jump back to the Q&A box. I just want to remind our our participants, if you have any additional questions for our great group of panelists today, please just drop them into the Q&A box and we will get them answered for you. And so the next question here, and this is going to be for any panelist who wants to take this one on, is how can faith-based organizations specifically help with this project?
I'm going to jump in on that one. Faith-based organizations are central and corner to the work that we do with organizations and individuals in communities. So many of our communities adopt, faith-based organizations adopt our Blue Zones organizational checklist. They engage and host our people engagement activities, which include purpose workshops, sharing information about the Power 9, and then also organizing and facilitating volunteerism to support some of the community projects and initiatives. Many faith organizations are already doing very similar work as a Blue Zone project. This provides an opportunity to share more about how other cultures and other communities are looking to improve their health and well-being through connection, through the elements of the Power 9, and share that with their organization. It can be a really meaningful and pivotal way to reach more people in communities. And we have some great results from that. Particular in Fort Worth, Texas, there are many faith leaders that work with us there, and one in particular who has really seen the opportunity to connect not only with his faith community, but then bring that to support and work in the school and support and work in the policy sector and environment. So there's a huge opportunity for engagement, even just for participants of that faith community, but at large to serve the community in a broader way.
Emilia, thank you for that, because I definitely agree with the comments. Our faith-based community is an essential part of our community, but I'll just add to that our faith-based communities are trusted voices of our community. It's where a lot of our members of community get their information right from their trusted sources. So it's huge for our faith-based community to be a part of the conversation, because in addition to the trusted voices, they are the ears of our community as well on the needs that are very specific. And at many times our faith-based communities, which will be important to this, hosting health fairs at their locations, pulling their community members in, providing health education, being able to answer questions. So 100% agree. I think they're a huge partner, huge collaborative effort with faith-based communities.
Thank you, Ashley and Emilia. All right, I'm going to jump back into our sponsor questions here. And so I have a question for Whitney Meyer with the Jacksonville Jaguars. So Whitney, with physical activity being one of the Power 9, it makes sense that a sports team would want to be involved. How does Blue Zones Jacksonville fit with other efforts supported by the Jaguars?
Yeah, thank you. And I know a lot of people are probably thinking that, right? I'm amongst health professionals. Where in the world do the Jaguars fit in on all of this? And it's so many people said this, but it's a true testament, a thankful appreciation to Melanie, Patz, and the entire Baptist team, as well for us. Florida Blue is our official community sponsor with the Jags. So when they both come together and bring a great idea to us, we do so many things together throughout the community. And much like Ashley shared, we keep coming back and hearing the same needs. And so what can we do to be a part of the greater issue here in Jacksonville? For us as an organization, we're really coming into areas of focus, right? If we're going to invest in a community, what are some specific areas we're going to focus on and be known for as an organization? And two of those are youth development and neighborhood revitalization. And again, when you look at that Power 9, that falls right into our goals as an organization. And today I'll specifically talk about a longstanding partnership with something that the league calls Play 60, where we encourage the youth to stay involved 60 minutes a day. But it's not just about being active and finding whatever thing that makes that youth, get excited, move their bodies around and stay active, but the nutrition component as well. right? Of how do you fuel up to play 60 minutes a day? And so for us, this is a great way. We always laugh and joke that sometimes we bring the cool factor to things too, that sometimes people normally wouldn't want to, they kind of tune out, I don't want to talk about my health, or I'm kind of nervous even to go there a little bit. And so for us, we thought that this was a perfect way for us to engage the community in a meaningful way and something consistent, right? I think a lot of times projects come together, great ideas, but what I like about this is the accountability portion, right? You have so many organizations coming together to work together on a common issue. And so for us, we're excited to be a part of that, excited again for the longstanding partnership and all the faces on the screen. I see we had start off with like 65 participants in the chat. It shows that this is wanted in this city. And so I'm looking forward to other organizations joining and finding, how they can participate and help us with this big lift, because it is big. And so it's going to take all of us to really focus in on this area. Thank you.
So Whitney, I do want to say, so now that you made that comment, maybe it's that we make the healthy choice the cool choice instead of the easy choice. So that's great. Thank you.
I like that, Debbie. I like that.
Thank you, Whitney. I'm looking in the chat box. I don't see any additional chats, or I don't see any questions in the Q&A. So before I begin to close anything out, I think first I'm just going to reach out to all the panelists here. I think this is out of all the history and heritage series that have been working on this with the DuPont Fund. This is the most panelists we ever had on one event. So I do just want to open up the floor to any closing remarks that any of you may have and want to share.
I just want to thank everyone for your passion for this, for your passion for your community, for your passion for this project. I also appreciate deeply the DuPont Fund bringing us in to have this presentation. I saw so many names and email addresses pop up in the chat, which is incredibly gratifying, meaning that people really do want to engage in this project. So we just have deep appreciation for all of it. Thank you.
I'll just add to that. Again, thank you to DuPont Fund for bringing us all together and for all the sponsors participating. And I did see in the chat when I scrolled through some questions or requests for the data that was presented, and we will send out information. There's also a Blue Zones Jacksonville website, and we'll send you all the link to that with more information available on that website. And thank you to those of you who indicated that you want to be involved. You are absolutely going to get some contact from the Blue Zones team. So we're excited about becoming a healthy and a well community. So wellness, as we've learned today, is more than our physical health. It does include our mental health. It does include our social connections, as Dr. Jones was talking about. And it's really critical for us to all have a purpose and know what we care about so that we can activate our lives around that purpose. And so I'm excited about the Blue Zones model and so thrilled that you all joined us today and will help us launch it off.
All right. Well, with that being said, I just do want to thank everyone here for attending today. And again, I just want to reiterate the learning objectives that we all hope that participants can leave this session today. Those were to better understand historical context for why Jacksonville experiences the health discrepancies we see today, as well as what a blue zone is and how the Power of Nine can help improve community health. And then how, as we as individuals and within our own personal networks, professional organizations can participate in the Activate Jacksonville Blue Zones project. So with that being said, this event is the second of 6 virtual discussions in the 2022 Two Centuries of Jacksonville series that is co-produced by the Jessie Ball DuPont Fund and myself, Ennis Davis of the Jaxson magazine. African American Cemeteries was our first event, which was held last month, and a recording of that event is available for anyone who's interested in it. Our third event will be hosted virtually in June, and it will focus on placekeeping versus placemaking. And so we love to have you join. So stay tuned for more details for following the Jaxson Mag on Facebook, Instagram, or Twitter, or thejacksonmag.com. So in closing, I want to thank all our panelists and all our guests again for taking the time to spend an hour and a half of your busy day with us. It's very appreciated. So have a great Thursday afternoon and a lovely upcoming weekend.
Thanks, guys. Thanks, everybody.